I would have. The spinning was so bad I couldn't walk even trying to hold on to the wall, and I couldn't even crawl. I would try to crawl.
Hi everybody, this is Sonia Justice with Realness Television. Today we're going to start a new series titled Medical Miracles, a Patient's Story. In this series we're going to have patients come onto the show, or people who've experienced some kind of miraculous healing, and share their story, their struggle, so we can inform and educate you. Today we have with us Shirley. Shirley has been experiencing symptoms related to Meniere's disease. She's going to be talking to us about that, schooling us a little bit about what the symptoms are like, how you can prevent or manage symptoms, and of course what gave the miraculous turn of events for her, right?
Right.
Yeah.
I'm Shirley Gilbert. I'm nursing supervisor at Northwest Hospital in Seattle.
Okay.
I have been in nursing for 40 plus years.
Oh my.
So I have a little experience in various areas.
A little.
The largest amount of experience I had was critical care nursing. I had worked 27 years in critical care nursing before I took the supervisor position.
Very, very cool. And I am currently doing a contract at your hospital, and that's how we met, and I absolutely love it there.
Good.
The nurses are
I like hearing that.
Yeah, the nurses are truly, truly awesome. So you experienced Meniere's disease. When did you start seeing the symptoms, or is this something you've experienced your entire life? Or
no, I originally had the initial symptoms in 92.
Okay, so it's been a while.
Yes.
Yeah. What happened? I mean, like,
my
how
friend
did it
and
come
I
up?
were driving down the road, going down to have a pleasant weekend at the beach, and all of a sudden it felt like the car was going over a rolling road.
Oh my goodness.
And I felt like I was going to pass out.
Wow.
And I had no idea what this was that was happening.
Right.
And then, you know, I said, I feel like I'm going to pass out. And she was also a nurse. She reaches over and takes my pulse. And then I said, oh, you've got to pull over. I'm going to get sick, which I promptly did.
Oh my
And
goodness.
at that point was when the actual vertigo started, and people use the terms dizziness and vertigo so
Like
synonymously, but they are so totally different.
Okay.
The vertigo, you might have a bad balance, need a little steady. With the dizziness, have unsteadiness, but with the vertigo, the room or whatever you're looking at is actually spinning.
Oh my gosh.
And that's
like you're standing still, but everything around you is spinning.
right.
Wow. What do you feel like?
And that indeed is part of precipitating the vomiting.
Right, right.
And
So
she
scary.
took the first exit off the freeway that she could, and if within just blocks there was a doctor's office.
Oh my goodness.
And she ran in and said, my friend is having significant problems. They told her how to go to the emergency room.
Right.
And we went there, and that's where the doctor initially said, I believe this is a Meniere's attack that you're having. You need to see an ENT specialist
And what's
when you get back
ENT?
home. Ear, nose, throat
Okay.
specialist.
Okay.
And which I did.
Okay.
And the one I saw said, no, this isn't Meniere's. It's it's like Meniere's, but it's not Meniere's.
And what did they base that on?
Well, that was the problem. He really didn't base it on anything other than symptoms.
Got it.
And I actually went to him for 5 years.
Oh,
And I had
no.
seen him, you know, with attack a couple times in the first couple years. And then it was about 3 years that I hadn't seen him. And I would have these attacks intermittently. They weren't
And were they
too
as
frequent.
severe as that first one, or
It,
were they
numerous-
progressing in intensity? I mean, did they
They
stay
were.
the same? They were?
yeah.
Oh my
And,
goodness.
And then I went back to him in about 3 years, and I said, is there anything that has come up with modern medicine in this period of time that could treat this?
So let's hold it right there. I want us to take a little step back and explain to people what Meniere's is.
Okay.
Yeah.
It's called Meniere syndrome, and it's an abnormality in the inner ear that most normal people, the lymph fluid will drain out of what's called the endolymphatic sac in the inner ear. But people with Meniere's, that doesn't happen.
Oh my.
So the fluid builds up, and when the pressure gets high enough, it causes this attack.
Then you get the sequelae symptoms that you were talking about, like the not just dizziness, but the spinning. And I think you had mentioned to me that something like roller coaster was the way the road feels like to you.
And with it, I had ringing in my ears for a long time before I ever had this initial symptom.
Oh, so you were just thinking you had tinnitus.
And yeah, it can be caused by numerous different things, and that is something that I live with all the time.
That is good to know, because there are lots of people out there who have ringing in the ears, and like you said, there's so many things that could be causative factors. So just being aware that this is one of the things that needs to be rolled out is a really good thing. But are they able to even diagnose it that early?
Yes, and this was the problem with the initial one that I had seen, that he really didn't do anything as far as tests. And
so what kind of tests?
I started having more symptoms, and I called my family doctor. It was the weekend. I got the partner and told him what was happening. And he said, I can't do anything. You have to go to the emergency room. And after you have this in control, he said, Monday morning, I want you to call Dr. Langman, who is a specialist in this area. And he gave me a whole new life.
And he's in Seattle?
Yes.
So just what kind of diagnostic tests do they do then?
They did this bar that had lights, flashing lights that would...
To see if they could induce dizziness or something?
And, yes.
Or seizures? Because that's what I'm thinking, seizures.
Well, it really does affect a person's life as if they did have a seizure, because you're so disabled with the attack. And he did one where he put cold water in the ear, and he did numerous tests like that that had never been done before. And he says, oh yes, you have Meniere's.
Oh wow. So did he have like a specific thing that he pointed to that made him decide that? Did they do an MRI on the head and saw that, you know, your lymphatic area, I don't even know what it was called, was filling up? I mean, like, what was the final?
That doesn't show up. It was the combination of all the symptoms and my reaction to the tests that he had done.
4 classic things with Meniere's disease. It's a ear disease. And the 4 things: number 1, hearing loss. Number 2, violent vertigo, where the room just spins around and keeps spinning. You get nauseated. It may be that you spin, or it may be that the room spins. Tinnitus, a ringing in the ear. It can either be a high-pitched whine, or it can be a roar, like a seashell roar. And sometimes people feel a fullness in that ear. If you have Meniere's disease, it's destroying your life. You never know when those episodes are going to be. That vertigo may keep you in bed for even 2 days at a time, or even longer. It could be short periods of time. It's a serious problem that requires specialty care. Now, usually the specialist will want to make sure you don't have a couple of conditions. Number 1 is a tumor in the 8th nerve, the hearing nerve. Number 2, Lyme's disease. But if those are ruled out, there is good treatment. Now, the treatment is usually a low-salt diet. So you have to avoid all salt. You have to get rid of salt. A diuretic, it helps lower the pressure on the middle inside of the ear, because there's usually increased pressure there. And sometimes some of the tranquilizers, some of the Valium, Xanax family, does something to relieve muscles in there that cause this, not because you're nervous or it's an anxiety condition, it's a medical condition. But sometimes those with a low salt diet and a diuretic lower the pressure inside the ear and all those problems go away. A professional needs this. Sometimes you need to go to a hearing center even. Talk it over with your doctor, see an ear doctor, and then see if you need to go to a medical center. There is help for you if you have Meniere's disease, so utilize it.
Can you tell people a little bit about how your life was, how it affected the things you did, like going shopping, like going to work, things like that during that period of time before they finally found a device that worked for you? What was that like? Were you able to get around freely?
I could, and
okay.
Initially with an attack, sometimes that the ringing in the ear would get significantly louder, but usually the initial symptom was my body would I would break out with just total diaphoresis sweating, to the point that literally my clothes would be wet.
What?
And I would feel really hot, really flushed. And that would be the first symptom that I would get. And then the spinning would start, and sometimes with some of the worst attacks that I would have, the spinning was so bad I couldn't walk even trying to hold on to the wall, and I couldn't even crawl. I would try to crawl and I would fall over, and I literally had to pull myself along the floor to try to get to a telephone to call 911.
Holy crap, that's so scary.
It was scary. And I had never had any real concerns about driving, because I had always thought that I would start having a symptom and I could just pull over to the side of the road.
Right.
And the last one that I had before I started using this device, I was driving the car and instantly the vertigo started. And it was terrifying because, the road was up in the air and the trees were down on the ground and just circling, round and round. It was like trying to drive.
But you were still sitting in the same spot.
Right.
It's just your perception of everything was skewed.
And it was like driving a car in a merry-go-round was kind of what the sensation of it would be. And fortunately, it was...
And you were actually on the road driving while this was happening with other cars around you.
Well, fortunately, it was early on a Sunday morning as I had just gotten off work, just feet before I was going to be getting on the freeway.
Oh, whoa.
So I was able to turn left into the big shopping center parking lot.
Right.
And started promptly getting sick and vomiting. And as I had my head out the door, this woman pulled up in the parking lot, which at 7:30 in the morning, that usually doesn't happen. And I saw the movement, I motioned her over, and I said, I need you to call 911, but they don't need to come with the sirens on. I'm having a Meniere's attack.
Okay.
And she said, oh, I know what that is.
She
said, my friend has it. One moment she's okay, and the next moment she's incapacitated.
Oh, my goodness.
And she stayed there with me until they got there.
Oh, that was such a wonderful thing to do.
But at that point, I did not feel that I was safe driving anymore.
No. What if you had gotten on the highway?
That's right. That's what I was thinking. I was very, very fortunate that I hadn't gotten on the freeway.
So what did you do then? How did you get around?
It was just days before I got this. Okay. And the attacks were coming sooner, more and more frequently. Okay. And I'd had 6 within an 8-week period of time. Okay. And I went to the emergency room, and the treatment of choice for a Meniere's attack is IV Valium. It's the most potent medication that will affect the inner ear.
Interesting.
And that is what has to be given when I'm in
When
the
you're in an
emergency room.
attack, right.
And there have been times, a couple different times, that I went into an emergency room and I know they thought I was just a drug seeker because I said,
Isn't
I
that
need Valium
sad?
treatment. And
Yeah.
they didn't know that that was the treatment.
Right.
And they insisted, no, that they would give me Ativan.
So it's also it's really great that you brought that up, because hopefully, you know, nurses who are watching or physicians who are watching who work in the ER, you know, will be aware of this, so that when someone has a symptom, you know, they will reach for Valium as the, you know, benzo of choice as opposed to lorazepam, which is Ativan, right?
Right.
Yeah. Interesting.
Yeah.
Wow.
And with the Valium, the whole extent of the attack is over within 4 to 6 hours. And of course, with the effect of the medication, I usually sleep for pretty much that period of time.
Oh.
But with the Ativan, the residual symptoms will maybe last up until 3 days in that
What?
I have really severe ataxia. I can't, I need I use my walking stick because that looks a little cooler than a cane. and have a real wide stance gait for maybe up to 3 days.
Can you explain to people what you mean by ataxia?
Unsteadiness, staggering.
And that's why you have to have that base so that you can balance yourself and you're using the cane. Yeah, so they're aware.
Yeah. Yes, and that was getting to be the significant problem also, because I was so unreliable at work, because you would never know when an attack was coming. And indeed, 2 times I did have an attack while I was at work.
Oh my goodness. So in a way, I mean, that's horrible, but in a way they can see what that does to you. So when you say,
Right.
when you incapacitated and you can't go to work, they know what that's like, and they know, they have seen you experience it, because it is pretty rare, is it not? Or is it very common?
I couldn't tell you exactly the
Yeah.
frequency of
Okay.
it, but there's certainly,
There's more
significant
awareness.
enough people have it.
Okay.
And a lot of the situation is that it's not really recognized at that. And as I went into that doctor
Yeah.
and
And he-
asked him if there was any new treatments, he said, no, there's no treatments for it. The doctor
Oh,
that I went to,
wow.
Dr. Langman, he said, oh yes, we will do this. We'll put you on a diuretic to get rid of any excess fluid in the ear. You must be on a low salt diet. You cannot have any alcohol. You cannot have caffeine. And, just boom, boom, boom. These are our treatments for this.
Oh, wow. And that's going to manage all the symptoms, or actually help? I mean, well, it's going to help decrease the fluid buildup too. So
Right.
that's, oh, wow.
But then my symptoms continued to
Right.
proceed.
Right.
And we were at the point of, I had already gone through the pre-op teaching.
Right. Oh, you
where
were going
he was
to have
going
surgery.
he was going to do a surgery where they essentially make an incision, lay the ear back, go into the inner ear, and insert a tube into that endolymphatic sac and take a little portion of the bone out, and this tube would drain. It works with some people, with other people it's not successful, but I was so
But you were
desperate,
desperate.
I was willing.
To try anything.
And
So just one thing about the incapacitation. I think I remember when we were talking earlier, you mentioned something about not being able to travel.
yes, I had always, from the time my
Because
grandson
you love
was
traveling.
6, I had always, every year I'd take him on a week's vacation, just him and Grandma on a one-to-one trip. And I do love to travel. At this point, I've been in 40 different countries.
Oh, wow.
And this totally,
Wow.
totally stopped that. For 5 years, I hadn't been out of the country.
Wow.
And I never did feel
Scary.
totally safe being by
Right.
myself.
Right, right. And then being in some place where nobody's aware, or they might not even be aware of the disease, and absolutely have no treatment for you.
Right. In
That's-
fact, it was coincidental that one of the nurses that I worked with had Meniere's. And when I was first diagnosed, she says, "Oh yes, I know about this." And she said, "I was in Austria having a Meniere's attack, and the doctors and I couldn't speak the same language, and they thought that I was having appendicitis, and
Oh my
we're discussing possibility of surgery."
No.
And yes,
That's just wow. It's an ear problem, and they were
Right.
going to cut out the appendix.
yes.
Communication is important, isn't it?
It definitely is. It definitely is.
Wow.
And fortunately, she either refused or got the message across or whatever.
Wow, that is truly scary. So let's talk a little bit about this device, because you brought
Okay.
this with me, or to me, into the show so she can show you guys. And so, how did this come about?
Well, we had already done the pre-op teaching,
Yeah.
and he said to me, he said, "Shirley, there's a new instrument that has come out, that has come over from Europe. It's very new, and it is not paid for by insurance, but I wondered if you wanted to look at it or give it a try before we did surgery." And I said, "Oh yes, I'm very willing to try anything short of
Anything.
surgery,
Right.
especially one that I didn't know would be 100% successful."
Exactly.
And it was at that point, and I've had it for 13 years or something like that, about that length of time. It was $3,700, but he,
Did insurance pay for it?
no, they did. But
Okay.
at that time, insurances were not paying for it. But he wrote them a letter and said we had already set up for having surgery, and this would be significantly less expensive than that
That
surgery.
was so
And they
nice
did. They
of him.
paid it like any other medical device at 80%, which I was so thankful
Oh
for.
my God, I would be too. And is this the only company that makes it?
Medtronic, yes,
They're the only ones that make it?
yes, and it's called
Oh,
a
it actually has
Meniere.
Meniere on it. Yeah.
That's the name of this device that's by the Medtronic company. And it's really a very
So I
simple
wanted to
treatment.
show it. So I don't know if they'll be able to see it at all, what it looks like. I just wanted them to see. So it's just a simple device, and it has an on button. And it even has a picture of the ear where you should put it, right?
right.
Yeah. Thank you. So do you want to show them
Okay.
what how it works?
So
or-
it's
So
essential that
he
it's
didn't
level.
have to do any surgery, or he had
No,
to put something
he-
in there,
So he
right?
put a tube in my
Right.
ear,
Okay.
and that's just a little myringotomy tube that just like kids have in their ear,
Okay.
so that the pressure from the air pulses could get through the eardrum.
Okay.
And initially, I was having symptoms that were so severe that probably one of the worst symptoms was that for periods during the attack, I would have blackout spells. And
Okay. This is wow. So you're having such spinning around to the point where you can't even crawl. You're having blackouts, like you're losing periods of time too.
right, at one point,
Wow.
I drove home and I just got into the driveway because I felt the attack was coming on. And I came in the house at 5:30, and I went in and obviously was sick, etc. But as I said, I would have these blackout periods that it was about 8 o'clock then that I had been laying in the floor, and when I was with it enough to pull myself into a telephone to call 911.
Oh my God, bless you. Wow.
It's not something I would
live
wish on anybody.
No. Not, I mean, because it's so common now, and it wasn't common in 1992, I would imagine. Some of the things that we have now is if someone has that, perhaps they could have something like a like a life alert or something.
Right.
So that
And
if-
I actually was thinking about getting one of those, and I kept thinking, I am too young to have one of these things. But I was considering getting one.
Oh my goodness. Oh my goodness. You've been through a lot. Thanks
I'm
for
very
sharing
glad
your
that I don't
story.
have to anymore.
I know. So we have about 5 minutes left
Okay.
in the show. So if you could show us like how it works and then let people know how it's made a difference for you.
It's just a 5-minute treatment.
Okay.
And I just put the earplug in my ear and have a really tight seal so that
Okay.
no air escapes.
And
Push
then-
the on button
Okay.
and sit there for 5 minutes.
That's it.
That's it. And initially, I was doing the treatment 4 times a day because my symptoms had been so severe.
Right.
But then I tapered it down to 3, and now it's just maintenance, and I'll just always do a maintenance twice a day.
Oh my goodness.
has
And
given
you
me
don't have
a new
that
life.
severe
No.
symptoms, a new life.
I still,
A new
I
life.
have some balance problems, that my vision is my balance, that in a dark room I could fall over, and I have the
Oh.
ringing. And
Okay.
one of the things that goes along with Meniere's is hearing loss.
Okay.
And indeed, I had,
You're beginning to.
had a significant
Oh,
amount
wow.
of hearing
Okay.
loss.
You had mentioned something about like sometimes when you're walking and then is the depth
Oh.
perception? Is that what it is or what?
No, it's balance.
It's
just the
balance.
balance.
Okay.
And yeah, sometimes I have developed these various
Coping mechanisms.
coping mechanisms that if
Thank
I'm
you.
walking down a hall, I look at a point at the end of the hall
Yeah.
and I can walk in a straight line. But if I happen to look down or if I happen to turn my head, then I might stagger. So I do these little compensation things like if I start to do a stagger, I just go over to that side of the hall. So it looks like I was
You were
just changing
intentionally
sides.
sides.
I don't want
Oh
somebody
my
to think I'm drinking on the job.
Oh no, you poor thing. Oh wow, that's amazing. I'm so glad you're able to come down and share with us.
I'm glad to be able to do it. I want
you
this
want people
information
to be
to be
aware
gotten
of
out.
it. So this is Meniere by
Medtronic.
Medtronics, right? So if you have Meniere's and your symptoms are severe, you should perhaps talk to your ENT, your physician about it.
Yes.
And thanks to that very knowledgeable physician, you know,
Yes,
for linking
does.
you up to this treatment. Because it wasn't even here in the United States. It had to come from Switzerland,
I don't remember what European country
but
was.
from Europe.
But yeah, I have had some attacks after I started this, but it was for a specific reason. Once the tube fell out, another time I had an ear infection, it was plugged.
Okay. Oh, wow. Well, thank you. And that has been it for our show today. This was the first episode of our new series, Medical Miracles, A Patient's Story. This is Sonia Justice signing off. Until next time. Bye-bye.